So my name is Ajay Srivastava. I'm a heart failure cardiologist at Scripps. I practice at Scripps Green and Prebys Cardiovascular Institute. Ever since my med school days, I was always drawn towards cardiovascular medicine. The whole physiology of cardiovascular medicine fascinated me. And then as I went through my internal medicine residency, it only built upon that, and I felt that this is my calling and this is what I'd like to do. I did my cardiovascular medicine training at Yale, at which point I developed a further interest in heart failure within cardiovascular medicine and decided to go to Stanford and do an additional year of training in advanced heart failure and heart transplant, after which I took my boards. And the reason I did this and wanted to become a board-certified heart failure cardiologist was I wanted to be the best heart failure cardiologist that my patients have access to, and somebody who's well-trained and is aware of all the different therapies there are to offer with somebody with advanced heart failure. Scripps Clinic Heart Failure Program was established about 10 years ago by Dr. Tom Haywood, who came over from Loma Linda. He has built truly an outstanding heart failure program with expertise across all disciplines of heart failure. My role is to take care of patients with left ventricular assist devices, or LVADs as we otherwise call them, and evaluate patients with advanced heart failure who are at a point in their disease where medicines are not working and they might need a heart transplant, they might need LVADs. So that's where my role comes in, to take care of patients with very advanced heart failure. So LVADs are left ventricular assist devices. These are pumps that are placed inside the thoracic cavity in the heart, and they're basically a motor that assists the heart in doing the function and pumping blood all over the body. And these are used in patients who cannot take medicines anymore and have such advanced heart failure, and they may or may not be candidates for heart transplants. I have many family members who have problems with heart disease. So every day when I come to work, I think of my patients as my family members, and I would like to do and provide care to my patients just as I would like somebody to provide the same level of care to any of my family members. So when I come into work every day, I try to do the best I can and to make my patient feel at ease and comfortable and help them through this very difficult disease. So the most rewarding part and the most gratifying part about my job is to see patients continue to live and spend time with their family members and their loved ones, and be able to go to graduation, be able to go dancing with their grandkids, be able to go on a cruise. I mean, these are patients who otherwise would not be alive. So to be alive and to be able to do all this with their loved ones is just absolutely gratifying.